Hi guys, this is Dr. David here from the Sporadic Health from the Hunter Valley practice.
Dr. James.
So today we are talking about ear infection. Quite commonly we see ear infection in little kitties, in children. So what happens is we know that medically we treat ear infection with antibiotics. And with children that complain and with signs and symptoms of ear infection, we often prescribe antibiotics to them, and in the US alone, each year for ear infection, we prescribe about 20 million doses of antibiotics to treat that. There are two types of ear infection. The first one is otitis media with effusion, which is typically known as without really acute signs and symptoms. We can see that there are some fluids in there, and often children complain that they are, my ears feels a bit funny, I can't hear you properly. And there's a second type, which is acute otitis media, where there's some fluids in the ear, and also it can present with a bit of fever and pain.
Yeah, so one of the big difficulties that happens is trying to differentiate the two diagnoses. As a result of this, we find that antibiotics are overprescribed because of the misdiagnosis of acute otitis media versus the otitis media with effusion. So, as Dr. David said, the big differentiator there is the fever and pain will be your acute otitis media. So it's a big difference there. So there was a study done recently which looked at how chiropractic care could come in to help along with your traditional medical care with acute ear infections. And it found that for some kids there is a really good response with some spinal manipulative therapy to help relieve these symptoms and help clear these recurrent ear infections a lot quicker. But there always needs to be that little bit more research to bolster this for both patients and practitioners to know that it can really work for most people. So if you are interested to know how we can help in the management of the ear infections along with your medical practitioners, give the girls a call and have a speak to our office. We'd love to see if we can help you out. All right, guys, have a great week. See you next time.